Okay, I think we're gonna go ahead and get started. Looks like we have quite a few people on tonight. So thank you so much for joining us and welcome to Donaldson Plastic Surgery. So sorry we can't do this in person tonight. We would much rather have an in-person event, but we do what we can during these times, right? So again, thanks so much for joining us tonight. We are so excited. Tonight we are going to be speaking on the newest innovation in facial filler from RHA. My name's Jill. I'm the aesthetic director here at Donaldson Plastic Surgery. So all things non-surgical, I'm your go-to for that. And facial filler is one of those. So we are going to talk with a couple of different people tonight. First, a little bit about our practice. We are located in historic Dublin. We've been in practice for over 10 years. And included in our practice are two board certified plastic surgeons, Dr. Donaldson and Dr. Michelle Seifert. And our mission and what we really work towards here as a practice, our main focus is to instill confidence in our patients. Our main focus is for you to be able to go out into your life and be the very best version of you. And everything we do here is for that purpose. So again, I just want to thank you all for being here this evening with us. I do want to let you know we are in webinar mode, which means we can't see any of the attendees. We can't see your face and you don't have your microphone on either. So what that means is you will be able to utilize the chat feature. We really encourage you to ask questions and engage with us during tonight's presentation. And we will be answering all the questions at the end of the meeting tonight or the virtual gathering tonight. So I'm going to go ahead and turn it over to Alexis. Alexis is our aesthetic representative from Revance Aesthetics, the maker of RHA. She has been in the aesthetic industry for over 13 years, and she is a friend of the practice, and she's also someone we turn to for advice and consulting. So Alexis.
Thank you so much, Jill. I appreciate that kind introduction. I love to be a friend of Donaldson Plastic Surgery. I've spent many years here, so thank you for that kind introduction. Again, my name is Alexis Palmer, and I am with Revance Aesthetics, and I am extremely pleased to bring you RHA, which is the latest innovation in filler technology. RHA is resilient hyaluronic acid. And you might be wondering, well, what is hyaluronic acid? Hyaluronic acid is a polysaccharide, a sugar that we all have free floating in our bloodstream. And what hyaluronic acid does is that it plumps and hydrates and volumizes our skin. It also lubricates our joints. Now, here's the bummer. The bummer is that when we're young, we have lots of HA free floating in our bloodstream. But when we start to turn about 20, your natural HA just starts to naturally deplete. So that's why you start to notice some loss of volume in areas of your face and even on your hands and other areas of your body. So we use hyaluronic acid to plump and hydrate and volumize our skin. So you might want to use maybe a Botox or a Dysport to stop facial wrinkles, like maybe on the upper third of the face. That's not really typically where we use an HA filler. We're usually using an HA filler from about here down. So what is RHA? RHA is resilient hyaluronic acid. And although it may be a bit new here to the States, it's been around for about 6 or 8 months here in the States. RHA is not new in the world. In fact, RHA has been in the world for over 5 years. So RHA, again, resilient hyaluronic acid, new to the States, but not new to the world. In fact, RHA has been in the world for over 5 years in over 96 countries with 79 worldwide approvals. So where do we use RHA? What can you expect from an RHA treatment? What makes it special? I want to answer some of those questions for you tonight. The first thing that's special about RHA is that it is the only hyaluronic acid filler FDA approved for dynamic wrinkles and folds. That word dynamic is incredibly important. Our face is moving all the time. My face is moving right now. So you really want a filler that's going to move with your face. RHA is the only hyaluronic acid on the market right now that has the FDA approval for dynamic wrinkles and folds. There are 3 different products within the collection. There's RHA 2, RHA 3, and RHA 4. And one of the injectors here will pull whichever product they feel is the right product for you. RHA 2 is our stretchiest product. So really think about maybe like a rubber band that stretches and bounces back and stretches and bounces back. That's really what you want to use. You want to use a very stretchy product in areas of the face that are really dynamic. So you want that filler to stretch and bounce back, stretch and bounce back. In other areas of the face, like nasolabial folds or mental crease, or around this area, the mid-face, you could use RHA 3, which is more of a utility filler. That's going to create a really beautiful natural contour. And then also there's RHA 4 that is sometimes used right here on the upper third of the face to create a natural looking contour. So that's the second thing that makes RHA really special. What can you expect from a treatment? You can expect beautiful, natural outcomes. Now, maybe some of you are out there tonight and you've joined us tonight, and we appreciate that. If you have any questions, make sure you type them in the chat feature. But you may be a little nervous for filler. Maybe you've seen Hollywood types and they look really done. RHA is going to create a beautiful natural outcome. And one of the reasons is because, again, it's moving with the face. It's going to create a subtle contour in that upper part of the face. And Adrienne can speak to her usage of RHA and tell you what she likes about it as well. The third thing that makes RHA really special is its long duration. So RHA is FDA approved to last for 15 months. 15 months, that's a long time. That's over a year. So it's also very safe. No kind of late onset nodules or anything like that are going to happen with RHA. A very safe and long acting filler. So those are some of the features of RHA, what makes RHA really, really special. Creates a natural looking outcome. It moves with the face. It is going to be very safe for you and those your friends that possibly may try it. And another thing about RHA is that you're not going to find it everywhere. RHA is only in selected accounts like Donaldson Plastic Surgery. So this is a highly prestigious, exclusive product that not everybody can carry. So we're so happy that you're here with us tonight to learn a bit more about it. And I'm going to turn it back to Jill, and I'll be here all night to answer any questions. So thank you so much for this opportunity.
Thank you, Alexis. Thanks so much. That was really insightful. I want to let everyone know that today is our first run at a virtual meeting through Zoom. So if you're noticing any sort of tech challenges, I know many of you love us so much and you'll just be so forgiving. So we really appreciate that. So the next thing we're going to do is toss it over to Adrienne. Adrienne is our master injector here at Donaldson Plastic Surgery. She has been with our practice for over 5 years, and she actually just recently celebrated her 5-year anniversary with us. So congratulations, Adrienne. She is really passionate about what she does. She loves doing filler. She has done everything that I have ever had done. So I have a joke that we should start a hashtag face by Adrienne. So if you all want to help me get that going, we can start that hashtag. So on to you, Adrienne, to talk to us about where these fillers can be used, how they change the appearance, and how they balance out the face shape and all that good stuff.
Absolutely. Okay, so as Jill mentioned, this is our first go at a virtual event, so please bear with me if I'm a little click happy and just racing through things, okay? So what you're seeing in front of you now actually is different areas that we can treat with RHA. And really the idea behind using facial filler is to restore lost volume. It's not always to augment, and as Alexis touched on, we do see some Hollywood types that are a little overdone. as a practice, we are more conservative in the forefront in addressing those needs. And we also really just want to give back the idea of youth without overdoing it. This photo in front of you is going to show some different areas that RHA can be placed. We see that she's had a little volume correction through the mid face, which you'll hear me talk a fair amount about tonight. If you've seen me in the practice, you've heard me talk about that before. Smaller areas that we really couldn't correct before with some of the other fillers, the older fillers, the thicker fillers, the less stretchy fillers, those dynamic lines that happen when we move our face, we're really able to kind of finesse and fine tune and get in there really with the RHA product. So we see some correction through the nasolabial folds, the marionette line, really through the chin and lower face, we're able to really address with this product, whereas before I just didn't have it in my toolkit. So we'll see if we can't advance through here. There we go. So what we have here actually is our first before and after. So this is going to show you a woman who has had RHA filler placed. She has had her mid face addressed. So we actually have added some volume here through the mid face. You'll notice what that has done to her under eyes. Has really brightened those up, but I really want you to focus on her marionette lines through here, her nasolabial fold through here. Without actually adding to this area as far as filler, we're able to pull back by providing a little more structure through the cheek area. And that really is the most important part when we are doing a holistic evaluation of the face, is to really address the root cause of that kind of sagging skin, rather than just addressing the effect of it. So onto this gentleman. It side by side doesn't look amazingly different when you first look at him, which I really like about this product. No one's going to look at you and say, oh my gosh, what did you do? No one should be able to tell that you've had anything done. So if we look at his nasolabial folds, he actually had a pretty serious fold to start. They have really been lessened through here. He has had a little bit added to the mid face, and he also has had a little added down here in his marionette lines to kind of bring that shadow out. Again, not very much. These are the products really 2, 3, and 4 that Alexis mentioned. 4 is really going to be more for that mid face. It's a little more structured product. 3 is going to give you a little more oomph, but also move really well with your face. 2 is going to be your lighter, softer filler. I use that most often in lines that are a little more superficial, and it's always my go-to for lips. So this lady, I actually love this photo of her because she really looks so much younger. She again has had 4 added to the cheeks, really has pulled back her nasolabial folds through here without actually having to add in there, has really brightened up her under eyes. For the ladies that are here, when you buy a makeup highlighter and you are highlighting this cheekbone area, the chin, kind of through here, you're creating another light source on your face. And that really is something that we can do with facial filler as well. So adding a little more structure through here with the RHA 4, addressing her jawline with a little RHA 4, and then coming in and filling some of these areas with that stretchier 3 has really brightened up her entire face. It moves with her. She doesn't look overdone by any means. And, you know, she's able to have a treatment today and she's back at work the same day, just looking a little more refreshed. Again, with this lady, and I love this one because you can actually see the light source on her face. If you look at her under eye was actually alone, not treated. We can treat the under eye by itself, but she had a mid-face revolumization. So we went in with RHA 4 and has really replenished this area, and really didn't have a lot as far as nasolabial folds, but you'll notice on her before photo, the shadowing that she has through here. We see that in photos. We see that especially on our Zoom calls. We rebuilt through here. We popped this area out and took the shadow out to give her another light source. And she overall just looks really light and refreshed. And this is going to happen with that RHA 4 and that 3 and 2 as well. My favorite model. So this is Jill, who you saw speaking in the beginning. So there's about a year difference in these photos. And Jill was stunning to start. And you can see how well all of what we've done has moved with her. So what we did for Jill was a syringe of RHA 4 in each cheek. And I tell her all the time, my favorite thing that we did was a little bit in her chin as well to extend her jawline. We did nothing to her nasolabial folds. The volume in her cheeks that we added really pulled her back. You can see even in her under eye area how much brighter and less hollow it looks because we've created that light source with that filler structure. And we also added a little bit of RHA2 to her lips. Now, Jill was very adamant. She did not want her lips overdone. I love a big lip, but I completely respected what she was saying, and it looks perfect with her face. The RHA2 in lips is just enough to give that hydrated look. And you can see here as a side profile, that nasolabial fold is really eradicated with just that little bit of filler in the face. And I do think it's important to note that when we're discussing syringes of filler, each syringe is 1 ml. It's 1/5 of a teaspoon. I could not overfill you if I wanted to with one syringe. But placing a little bit in each cheek, and again here in the chin for Jill, you can really see what that has done for her jawline and has really pulled back so her nasolabial fold is gone. And of course her lips look really cute and youthful with just a little extra RHA2 in them. That's another profile. So this is actually an important photo to mention. Not every before and after photo is going to look amazing in the real world. This photo of Jill, of course, does look amazing, but what you'll see here is something that's very important when we're injecting. If you notice the nasolabial fold through here, it's not as amazing as the other side looked. That's because our faces are not symmetrical. They're never going to be. We can get them as close to perfect as we can. But Jill actually had an improvement all the way through. You'll see in talking with her, especially if you're in and out of the office and seeing her in person, that it's nothing apparent. But in this photo alone, the shadow that you see here is just something that we have asymmetry side to side. But if you look at the lower part of her face, where we've built a little extra volume through here, a little extra volume through here, how much it has looked that we've kind of debulked this area of her face. Now, Jill has no bulk on her by any means, but it really has slimmed and shaped her face that we couldn't have done without the filler. And again, she had the RHA 4 and the RHA 2. So we definitely want to hear your questions about things. I really do love this line. I think that it's been a fabulous addition to the toolkit that I have. I do have, other fillers as well, but this has really been my go-to for the softer, more flexible look. I can pretty much guarantee that using these products, you're never going to look overdone. It's going to be a lot more softer and natural looking. And generally that's what people come to me looking for. There are several options that, we can kind of choose from. And the combination of all of those options really leaves you with an overall holistic rejuvenation of the face without looking like you've stepped foot in a plastic surgery office. Let's see if we have some questions here, unless there are additional slides that come up for us.
Yes, so it looks like we do have some questions. So someone says, how soon will you notice the fillers? I think what they mean is, how soon after treatment will we notice results?
Okay. So for those who've been in my chair before, some of these are going to sound redundant because I tell this to every patient. Your filler is going to be immediate. We are placing a product that's going to restore the volume. You are going to see that volume right away, but you're not going to love your filler until about 10 to 14 days after. The reason for that is it's going to take time to integrate with the tissue. You are going to have some swelling afterwards. We are creating a small amount of trauma with that needle. That is just the nature of facial filler. So it really is going to be about 10 to 14 days before it's completely settled. All the swelling is gone. HA, the hyaluronic acid, its job is to kind of attract a little bit of water. So we want it to kind of settle, to kind of plump up a little bit. I'm going to say about 2 weeks tops to see your full results.
Okay, let's answer Lavinia asks how much filler was used on her. I'm not sure if she means me or another one of the models, but we can speak on mine.
Okay. Jill had a syringe of RHA 4 in each cheek. So that's going to be 1 ml in each cheek. We also did a syringe in her chin. Actually, that may not be true. We did almost a syringe in each cheek and then used a little bit in her chin and then a syringe of RHA 2 in her lips. So she's about 3.5 syringes total.
Okay, Peyton asks, what makes RHA different from other products? I know we touched on this in the beginning, but I think we can probably afford to hear it again. So Alexis, I'll pass this one on to you. Quickly, what are the, I would say, top 3 main differences between RHA and other HA fillers?
Right. Thank you for the question. It's a great question. Really, that word dynamic in our FDA approval is one of the things that makes us highly differentiated from other HA fillers on the market. So the FDA has approved us for dynamic wrinkles and folds. So they're giving us their vote of confidence that yes, this product actually moves with the face back and forth, back and forth. So that's the first thing. And the second thing is that it's a designer filler. Now, what we mean by designer is that not necessarily it's the Chanel of fillers or whatnot, although I do think it is, but that it has been specifically designed to be more like the natural HA in our skin. So Madame Valerie Taupin, who is our creator of RHA, who by the way was the co-creator of Juvederm Ultra and Ultra Plus, she knows HA fillers very, very well. Her specific specifications for RHA was that it moved with the face, number 1, and number 2 is that it was more like the natural HA in our skin. So those are 2 of the things that make RHA a bit different from other HA fillers on the market. I hope I answered your question.
Yeah, thank you so much. John wants to know, how quickly can I get in for a consultation/treatment? I'll go ahead and take that one. So we can typically accommodate consultations within, 3 or 4 days time. And we can typically get you in for treatment within 2 weeks when it comes to filler. So definitely reach out to me and I can get you scheduled. And everyone has my email. So I'm glad John mentioned this. Everyone received my email when you received your link. So please reach out to me. I'd be happy to get you scheduled. And if you think of any questions that we don't touch on this evening, you can reach out to me through email as well, and I'll make sure I get those answered for you. Maggie says, is bruising a concern?
So I will answer that. Yes, always. I am poking you with a needle, guys. You're likely going to have some swelling and bruising. Some people tend to bruise more than others. I do everything I can to mitigate that bruising. A lot of it is understanding facial anatomy, number 1. Number 2, we're going to have you do some things afterwards that are really going to help kind of knock out and slow down that bruising. But the fact of the matter is you may have some bruising and swelling with filler. So that is something, especially with your scheduling, that you will have to plan around. Usually it's not an issue, but if it is a concern for you, make sure we talk about that before your appointment.
Great, thanks so much. And, oh, this is a great question. Maggie also asks, is downtime from exercise suggested after receiving treatment?
So what I tell people, and this may not be the same from every injector that you've heard from, is that you're going to treat this like any other injury. I am going to create a little injury with that needle. What would you do if you had tweaked your ankle? What would you do if you had pulled a muscle? You might take a little bit of time off. Anything that really gets your heart rate up over the next couple of days is going to make you swell a little bit more. If that's a concern for you, certainly take that time off. I get my filler and I go right to the gym. It doesn't bother me at all. So, you don't necessarily have to. Just know that your swelling, maybe your bruising might be a little bit worse if you choose to exercise within that first 24 hours.
Awesome. Thanks, Adrian. And John asks, how many patients have we seen so far that we've treated with RHA? That's a really great question. I actually don't have the exact number. on hand. I can tell you though that RHA has been quickly becoming a really popular product to use in our practice. So we do use this, I can definitely say with confidence, every single day in our practice, we are using RHA, and we've had it in the practice since, when did we bring this in, Alexis?
Actually, Donaldson Plastic Surgery was the first practice in Columbus to bring RHA on board, and that was at the beginning of September. Yep.
Okay, so yeah, we've had it since September, and we definitely do treat with RHA every day. All right, so the next question is, someone says, how long does it last? I know we touched on that a little bit, but we've covered a lot of information. So I think that's another thing, a good thing for us to cover again. How long can we expect our results to last with RHA?
RHA is FDA approved to last 15 months, which is on the higher end of a lot of fillers. A lot of fillers are FDA approved to last about 12 months. So here in the United States, RHA is approved to last 15 months.
Awesome, thank you. And someone else says, Colleen says, what is the cost per filler? The cost will absolutely range. You're looking at anywhere from, $750 and up, and that's really just based on your consultation. So that's why consultations are so important. We really want to get you in the practice, talk about your needs, and then we can definitely quote you price upon when you're here for your consultation. It's hard to tell when it comes to cost because we don't know which product will be best for you, and we don't know how much product will be best for you. So all of those things will determine what your final cost is at the end of your treatment. Mm-hmm. All right. Does anyone have any burning questions that they're just dying to get out there? All right, like I said, again, you're always welcome to reach out to us. Adrian is an amazing source for education. I can help you as well. So let's move on to the most exciting part of the evening. All right, so we have a special offer for you tonight. Anyone who participated in our event this evening, we are offering $100 off any filler treatment, and that includes multiple treatments. So again, we don't want to say how much you'll need until you come in. Actually, let me rephrase that, how much you may want. Nobody needs filler, but I definitely want it, I'll tell you that. So come on in, get a consultation. Also, what we're offering for a special is we are waiving our consultation fee. Our consultation fee is typically $100. So we will be able to get you on the schedule without having a consultation fee. And we will also offer you $100 off your RHA filler treatment. And again, you all have my email, so feel free to send me an email. I would love to see you. I would love to get you scheduled. And thanks so much for joining us this evening. And I hope to hear from you all soon.
Thank you, guys.
Thank you very much.